Welcome back. Did you know that periodontists specialize in the placement of dental implants? No, neither did I. Board-certified periodontist Dr. Richard Aguila of Jacksonville Dental Specialists is here to talk to us about the specialty and what being hybrid certified means to those seeking dental implant solutions. Good to see you, man.
Good to be here, as always.
Did my dad finally come and see you?
He did, yeah.
Excellent. Yeah. He's going to have to get, I think, a single. But we're talking about your specialty, and as a periodontist, talk about how that specialty helps your patients and is a much more in-depth field of study in dentistry.
Yes, perio literally means around the tooth. And what a periodontist, my specialty deals with the diagnosis and treatment of diseases that affect the supporting structure of the tooth, the gums, the bone. Another part in the specialty is the surgical aspect of dental implants. Advanced surgery, bone grafting, sinus grafting, sedation, all these things that are needed to successfully place dental implants in the most compromised areas for patients. My partner is a prosthodontist, and his specialty is on the restorative side of restoring teeth and the implants. So at our office, you're one of the few, if not only office in Jacksonville, where you're actually seen by both a surgical and a restorative specialist under one roof. So that's a big advantage for patients.
Yeah, they don't have to leave one building, go to another. You guys are all in the same building. So,
right.
And you can pull him in. You've talked about that before. You can pull him in at times to take a look at something real quick, and you guys can figure out on the go there. But out in the market, in the media, you're bombarded with all kinds of, obviously everyone is saying things from teeth in a day, promising an easy fix to complex solutions. But talk a little bit about, we mentioned it in the open there, hybrid certified and what that means.
Yes. The thing about hybrid certified is you don't have to worry about the experience level of your doctor. It's a national network of providers, typically comprising of specialists, prosthodontists, periodontists, and oral surgeons, and also encompassing that group is very well-trained general dentists. Okay, so who have a lot of training, experience, and expertise with dental implants. With hybrid, a lot of times we do cross-training. We meet once a year, and we talk about treatment protocols. Treatment protocols to make things more efficient for patients to get the care that they need. Make things more minimally invasive for patients. So it's a network of providers that are well trained, up to date in technology, that provide complex dental implant therapy for patients.
Something you're probably dealing with a lot, and you talk about this, is the anxiety people have, the peace of mind they want. And it's not just about the whole procedure, but the peace of mind knowing that the formal training, the specialized training you have, a little bit about what gives them the peace of mind and the safety measures
right.
in the operation you run.
Yes. As we said before, the expertise of the doctor is important, as well as treatment protocols. In our office, we have the most up-to-date technology available. Sedation dentistry, cone beam CT scans, digital impressions, things of that nature that allow us to properly plan each case and do things very predictably for patients, and that's very important for patients today. Yeah.
If a patient out there suffers from gum disease now, can they still have hybrid restoration? I mean, if you're having gum disease, you got issues there, can they still have how will hybrid be affected by that?
That is a great question. Periodontal disease is very common, and approximately half of all adult Americans have some form of gum disease. It might be mild, moderate, or severe. It might be localized or generalized. But probably a good half, 50% of the patients that we see are losing teeth because of gum disease, and they see us because they want a full mouth replacement. If you have gum disease, it doesn't mean you're not a candidate for hybrid, because what hybrid does, once you get rid of the teeth, you establish health. You change that environment within the mouth. And once health is established, I like to tell patients you're given your third chance. You've got the baby teeth, okay? You've got the adult teeth, okay? Now we're going to give you dental implants and hybrid. And it doesn't mean you're not going to have any problems. The nice thing about Highbridge is they're less susceptible to periodontal disease. You know, you still have to take care of things, you still have to come in for your cleanings, but it's that third chance of having teeth and enjoying the, you know, the aesthetics and the function that they provide for patients.
Always so much information you give us in these 5 minutes, but obviously we can't answer all the questions. Best thing for you to do out there, folks, is the seminar. You guys offer a seminar once a month?
Yes, we have a seminar. It's typically the third Wednesday of the month. It's the 23rd of August at 6:30. We talk about implants. You get to meet the doctors and the staff, and from that seminar you get a complimentary consultation as well.
There you go. Best way to get the answers there. Real quick, more likely or less likely if you drink soda to need Highbridge?
More likely.
Thank
for sure.
you. There we go. We'd like to thank Jacksonville Dental Specialists for making this segment possible. And you can call 904-460-4201 today to schedule a consultation, or you can visit their website to learn more. It's jacksonvillehighbridge.com.